Hello everyone, I am Dr. Utkarsh Bhagat. I am the Director and Head of the Neurosurgery Department at Narayana Hospital, Gurgram. Today, 8th of June is a World Brain Tumor Day. On this day, let's dig deep into this formidable entity and find out more. So you would be surprised to know that there are more than 130 types of the brain tumors, and together they represent just 1.3% of all cancers. However, they are responsible for 3% of all cancer deaths. So, brain tumors are abnormal masses of cells which damage the brain by invasion and by putting pressure effect on the brain. So, brain tumors can be primary, meaning the tumors which arise within the brain. The common terms that you would have heard of are glioma, meningioma, ependymoma, medulloblastoma, and then there are secondary tumors, means tumors which spread to the brain from other parts of the body. Further, tumors can be benign or malignant, which are also commonly known as brain cancers. For most of the brain tumors, we don't know yet what is the cause of these tumors. Only about 5% of the tumors are hereditary. That means they are passed on from generation to generation. But majority of the brain tumors, we are not yet clear what causes them. There are some things like exposure to ionizing radiations, chemicals, smoking, alcohol abuse. So these things increase the risk of having a cancer. Brain tumors can present in many different ways. Commonly, symptoms are headache, seizures, weakness in one part of the body, or problems in hearing, vision, difficulty in balancing, coordination, even memory problems, change in behavior. So there are so many things which are possible when a brain tumor is developing. One of the common symptoms is headache. Now, headache is very common, and we need to know that the headache which happens in brain tumors is somewhat different. So headaches which are very severe, which do not improve with time, which happens usually in the morning, awakes you from sleep. So these are the ones that we need to investigate more carefully. So once we have interviewed the patient, we examine the patient for their basic neurological functions, and then we need some kind of imaging. For diagnosing, MRI brain is the best imaging, and with MRI we have a very clear idea of what the disease entity is. So once we have diagnosed the tumor by MRI, we need to know how big the tumor is, what is the location of the tumor, what is the type, what is the grade. And then accordingly we plan our further management. Frequently, surgery is the initial and the mainstay of the treatment, followed by chemotherapy and radiotherapy in high grade cancers. So talking about treatment, now the therapies are quite safe, and the same can be said about surgery, even chemotherapy and radiotherapy. There are some new things which have come up. Like in surgery, we use navigation systems which help us reach precisely where we want to reach in the brain with very small cuts. Then we do awake surgeries also. So when patient has tumors which are close to the functional areas, then we go for awake surgeries. During these surgeries, patients remain awake while we remove the tumor, and at the same time we check their functions. So in this way, safe tumor removal can be done while preserving the patient's functions. Besides, there are some more developments like use of fluorescent dyes. So these are other adjuncts that we use to remove the tumor. Apart from surgery, there are some more modalities for high-grade cancers like radiotherapy. Even for radiotherapy, there are some new techniques like stereotactic radiosurgery. These techniques are used for benign tumors, but for high-grade cancers, typically the radiation course would be something like 4 to 6 weeks, and that goes from Monday to Friday, 5 days in a week for roughly 6 weeks. Well, the diagnosis of brain tumor can be overwhelming, but with timely treatment, we have now good techniques and ways to manage this entity. So we also need to know that not all tumors are cancers. Some tumors are benign also, where surgery alone can cure the patient. Even for the high-grade cancers, there are treatments if if started well in time, they can prolong better quality of life. So one should not be scared. They should seek timely treatment, and timely treatment can really make the difference.